Alabama now has 22 confirmed cases of the COVID variant that was first identified in the UK. At least one of those cases is here in Madison County. Just last month, the CDC ramped up its screening for variants throughout the U.S. and here in Alabama. WAAY 31's Megan Reyna joins us live outside Huntsville Hospital. She learned more about the screening process and why Madison County may have more cases than we even know. Megan.
Right now, the Alabama Department of Public Health is working with the CDC and private labs to screen for COVID variants. Dr. Karen Landers with ADPH said that while there is a confirmed case here in Madison County, the CDC is not specifying how many cases are within each county, which means there could be more than we know.
So I think the most important message right now is that we are actively engaged in surveillance and that we are not doing surveillance with just one single laboratory doing sequencing.
In Alabama, 1,778 positive COVID-19 cases have been sequenced for COVID variants. That's 0.366% of cases in our state. Out of those cases screened, the CDC has confirmed 22 cases of the variant first identified in the UK. But there are two ways this state is screening for mutations. One is through sequencing, which means a certain number of positive COVID tests are sent to the CDC or labs.
The other is that if there are specimens that when they are being tested by PCR show a slightly different pattern around the spike protein, that might indicate a variant.
But the U.S. only recently started ramping up screening.
The United States in general, we're running behind in the screening process for mutations. And unfortunately, that applies to a lot of different things as well.
Dr. Ali Hassoun, an infectious disease specialist for Huntsville Hospital, says the CDC was screening less than 1% of cases. According to the CDC, it began regularly receiving COVID-19 samples from state health departments and other health agencies in November. Then, on January 25th, it scaled up the process to receive 750 samples a week.
So their aim now, as they trying to get more funding to go up to 10% of the viruses to be screened.
Hassoun points out the UK has consistently been screening 10% of positive cases throughout the pandemic. South Africa is now screening at least 5%. He says it's important the U.S. continues to ramp up this process.
It's very important to detect these changes very early, to take precautions if you can, or prepare for this.
By learning more about these mutations, Dr. Hassoun says that they can better determine if there needs to be any changes to treatments or vaccinations. If you do have the variant, you will be notified by the health department and a case investigation will begin. Reporting live in Huntsville, Megan Reyna, WAAY 31 News.
Thank you, Megan. Dr. Landers says there are companies working on COVID-19 tests to detect variants, and this would be different from the PCR and rapid tests that are available now. But so far, no companies have filed for emergency use authorization.